Welcome to this session on apical offset. We often focus on horizontal forces, but vertical dimension matters immensely for mechanics. The rigidly fixed implant is restored with a beautiful crown. The residual recedes apically as and when bone resorbs. This apical offset increases the crown height space and results in longer restoration. The gingival tonic ceramic is used to restore aesthetics, but this offset harms the biomechanics under offset loads. Dr. Weinberg established a mathematical relation between the apical offset and the torque acting on the implant prosthesis. For 1 millimeter increase in the apical offset, there is 4% increase in the torque acting upon the implant supported prosthesis. Always remember 1 millimeter of extra height adds about 4% extra stress. Think of it like a lever. Even a slightly longer lever increases the force needed to do work. We must consider this cumulative effect. Implants are biomechanically strongest when the forces are directed along the long axis. Forces passing through the center of implant are optimally distributed. This is the biomechanical ideal we are aiming for. The force is directed straight down the barrel of implant. The bone is designed to handle the axial compression efficiently. When forces stay within this axis, we minimize the rotational stresses that can lead to crestal bone loss and mechanical component failure. This is the implant supported prosthesis touching the occlusal plane, which is the average planar curvature formed by the incisal surfaces and the occlusal surfaces of anterior and posterior teeth respectively. The crown height space is the distance of separation between the occlusal plane and the ridge crest. As and when lateral offset load is applied to the implant prosthesis, the resultant line of force deviates from the center of rotation of implant body by a distance of x. Hence, the torque acting upon the implant supported prosthesis is Fx. The biology dictates our biomechanics. The bone resorption, when occurs, reduces the residual ridge height. The ridge resorption increases the apical offset by displacing the ridge crest apically, as can be seen here. Thus, the crown height space rises drastically. As the alveolar bone atrophies, the implant platform must be positioned more apically. Consequently, the increased crown height space needs vertically taller prosthetic crown to restore the original occlusal plane, thus increasing the cantilever effect. The gingival ceramic tone is used to restore aesthetics. This shifts the center of rotation of the implant body apically and lengthens their working arm to Y. Hence, the torque acting upon the implant-supported prosthesis is Fy. According to Weinberg, the final torque is greater than initial torque by 4% for every millimeter increase in the apical offset. Let us plot apical offset along the x-axis and percent change in the torque along the y-axis. The torque acting upon the implant-supported prosthesis at some degree of apical offset is shown by a bar. The moment we increase the apical offset by 1 millimeter, the torque acting upon the implant-supported prosthesis increases by 4%. So the whole process repeats itself if we keep altering apical offset, that for every 1 millimeter increase in vertical offset, torque increases by 4%. This is the rule of thumb to remember that 1 millimeter extra offset means 4% more torque acting upon the implant supported prosthesis. Hence, the clinician must consider the bone augmentation procedure to circumvent the apical offset